Hey everyone, welcome to another edition of Digital Voices. And this is super because it's a returning guest, Dr. L. But there's a big change. And then that's what we want to talk about, Dr. L, in terms of where you are and what you are doing. But welcome to EDTalks.
Thank you so much. Thank you for having me again. It's always a pleasure to see you. My name is Margaret Latsky. I am a general pediatrician, and I am currently the Vice President of Digital Health Innovations at the American Medical Association, which is a role that I started almost a year ago now.
Yeah, I'm super interested in diving deep into this because we've never had anyone from the American Medical Association on one of our programs. So really interested. Plus, your very unique background, which we'll give like a quick brief overview before we jump in. Given your background and this new role, it just like makes perfect sense. So I can see why you went for it. So Dr. L, just for our listeners who may not be familiar, although I think everyone is, just a little bit brief on your background, like where you came from, and then we're going to dive into some of the things that you're doing with digital health innovation.
Yes, absolutely. So, as I mentioned, I'm a general pediatrician. I still practice. I see patients as a pediatric hospitalist. And in my previous life, I have had multiple CMIO, CHIO roles at various institutions, academic, non academic. So, very interested in how technology can support our physicians. And when the AMA called me about this job, it was a very natural fit.
Yeah, that's what I love about it because you were like, it was almost like all these roles sort of prepared you for what you're doing now. So yeah, tell us a little bit about it. And is this the first? Are you the first leader in this role? Are you pioneering a new role, or did it exist previously?
So there was a VP of digital health before me. She was not a physician, and before her, there was a physician in the CMIO role. So the AMA has had similar roles before. I have had the pleasure of re-envisioning the strategy for this role. So that's been a really exciting journey for me. Just to back up a little bit and give people an understanding of where I fit within the AMA, I sit in what we call PS2 lovingly, which stands for Professional Satisfaction and Practice Sustainability. And so that is a group that is specifically focused on supporting our physicians and, of course, all of our clinicians in their use of technology.
Yeah, that's awesome, and I appreciate the fact that the American Medical Association does this for their members. And like we said, your background then makes you like the perfect candidate to take this next level. So you mentioned that you were sort of re-envisioning the role and the department, if you will. What kind of strategies are you thinking about?
So when I walked into this role, the first question I asked myself is, what are physicians struggling with today? And we all know that technology is integral in our ability to care for patients. In fact, most people see the EHR as the primary technology suite, but we know there are often 400 or 500 other systems that are integrated within the EHR that we're experiencing on a daily basis. And the question that we talk about is, how can we make the use of technology seamless for clinicians? And how can we start to get to a place where technology is enabling our ability to care for patients, which is why we went into medicine in the first place. So that was where we came from. The team has spent some time creating a vision and a mission, and that is our vision is a time where technology is there to support our ability to care for patients.
And in this first year, have you been traveling around or meeting up with your cohorts of physicians?
Yes, I always like to say that in the first year, it's time to ask a lot of questions. So that's exactly what I've been doing is traveling, talking to physicians in all care settings. So we know there are people that are in small practices, one or two physicians, and then there are people in large integrated health systems. There's a lot of M&As going on right now. So the environment is changing for our clinicians very quickly, and the technologies that they're using are also changing quickly. So asking a lot of questions of the physicians, but also really thinking about what are some of the other stakeholders, technology companies, government bodies. And as we develop our strategy, at the center of a lot of this is the clinical informatics community, the physicians that are trained to think about the optimal way to integrate technologies. So that has been how we have framed our strategy is with all of those stakeholders in mind and making sure that we have the right people at the table in designing optimal workflows, and workflow is at the center of everything, to be able to support our clinicians.
Is there one or two particular technologies that you think will kind of be the focus in the next few years? You know, ambient listening being one example. Are there other that you think will, again, sort of be game changers for physicians?
Yeah, it's interesting. We talk a lot about AI, right? Of course, that is the topic of the hour. And I do think that AI, ambient being one of the tools, but also things like summarization tools, are going to change the landscape. But with a few caveats, they need to be thoughtfully integrated into current workflows such that we're presenting the appropriate information to our clinicians. But, I heard a very interesting statistic about a week ago. I was at a meeting in DC, and somebody said that 20 years ago, we had 7 pieces of data on an ICU patient. Today, we have 1,300. And so we've gotten to a place, right? It's amazing. And then he talked about the various permutations of those data pieces would be 7 factorial, which is a number that nobody can keep in their head. But then you get to 1,300 factorial, and that is more than the pieces of sand on Earth, just to give you a sense of what we're asking physicians to process on a daily basis. And so I think that's where the power of these technologies is to start to support us and bring us back to a place where we are focusing on the medical decisions we need to make. And there is a computer that's helping to present the data that we need to be able to support.
So you're in a unique role now that you're with the AMA. Again, it's only been a year, but it's been a year, and you've traveled around quite a bit, and you have a lot of this great background working for on the provider side as a CMIO, CHIO, and those sort of things. What is one or two things you might recommend for hospitals that haven't made a lot of investment in their clinicians? So in order to sort of, understand the digital capabilities and go next level, and maybe it's not a big academic medical center with a CMIO and a team. So for the average hospital, what sort of recommendations would you make if they don't have a CMIO, as an example?
So, people ask me that a lot. And what they often expect me to say is to name particular technologies. And I always take a step back and say that to me, the most impactful thing a system can do is to create optimal governance. Now, it's not a topic that is as exciting as the new technology tools that are out there. But at the end of the day, creating a process to allow clinicians to have a voice in the technologies that are selected, I always say that it's so critical to make decisions as close to the care as possible. I'm a pediatric hospitalist. I really understand our needs, but I don't understand the needs of the cardiologist as well, or the needs of the infectious disease physician. What is important is that partnership. So creating a model where you can make those decisions close to the care to meet the needs of the clinicians, and yet have the right experts also in the conversation to design the workflow, knowing best practices for how technology should be implemented. So having that partnership, the dyad triad model, in my view, is probably the most impactful thing a health system can do to help support their clinicians. As we discussed, they're struggling in this world of overwhelming data and overwhelming amounts of technology.
Yeah, Dr. Al, that's why I love you so much, because I completely agree with you. A lot of times we jump to, hey, let's implement all this tech, and we know what happens. If you don't have that dyad model, it's not going to get adopted because don't understand the workflows and different nuances of practice. And if you don't have a governance structure in place, then you're going to go haywire, right? And nothing's going to fit in the big picture. And now you're going to have 100 different systems that a clinician's going to have to know how to operate, and data's everywhere. So you're spot on with that advice, is set up some sort of dyad capability and a strong governance function around it. And then the rest becomes a lot easier, for sure.
And especially as these new AI tools are coming into the picture, we talk a lot about the risks, and I recognize the risks. They're all there. And we know the power of these tools to change the way that we deliver care is astronomical. And so we have to think about setting up these governance models, because we're going to get to a place very quickly where if we don't have them set up, we're not going to be able to deliver the tools that are necessary for clinicians to provide the best care for their patients.
All right, one last question. I'm going to put you on the spot here because we've been talking a lot about governance, and it's funny. And I speak a lot, and people ask me to speak about governance. We've been speaking about governance for as long as I've been in IT. And I'm afraid it's like 25 or 30 years now. What would you say to a hospital, a health system, or a big physician practice that has no governance? What might be a couple ideas on how to set it up to make it effective? Because even where there is governance, and that's why people still talk about it, it's not working real well. So what do you have one or two best practices you might suggest?
Yeah, absolutely. I've spent a lot of years setting up governance in organizations. And what I say to people is the advice I share is from lessons learned and mistakes made. And the model that I advocate for actually came from learnings in a health system where we implemented the EHR. And I noticed that for whatever reason, the NICU just really didn't have any concerns. They were working smoothly. And so I started digging into what are they doing that's different than the rest of the organization. And what they had this triad model that they pretty much developed on their own. They had an engaged physician and they had an engaged APP that worked together with the informatics department. So anytime they had a concern, they put it through the process, it got prioritized, and it got fixed. And so we actually implemented this triad model of physician, nurse, and informaticist across the system, which gave people a voice. I'll tell you, when I presented it at a physician meeting, it was the first time anybody ever clapped at my IT update. So people really liked it. The physicians really liked it. But also, we decreased IT demand in the first year by 50% for our hospital, and then the next year by another 50%. So I think that a lot of those lessons learned of giving folks a voice at the bedside and then bringing that into a centralized model. And the final thing that I want to share is that it's really important to also have the executive group have very clear guidelines for how to drive these changes. And having those layers of governance is very important. If you give everybody a voice and you don't bring it all together, then you create other.
Right. This is really good advice. I know that our intent wasn't to talk about governance, but it's really important for all the things that you're doing, actually. So, Dr. L, can a hospital administrator or your primary cohort, members of the American Medical Association, they want to know more about what you're doing with digital health innovation? How do they engage with you?
Well, first of all, my door is always open. Please reach out to me directly. I'm happy to work with anyone that would like to discuss these topics. We really believe that the AMA has a role in this space to be able to create some guidelines and benchmarks for best practices. We have, of course, physician memberships. We also have group memberships for hospital systems. And my goal is to get to a place where we do have some of these benchmarks and we can work directly with physicians and organizations to help them do this in their space in a way that works for them.
Yeah, love it. And we'll put information in the show notes as well. Dr. L, thank you again for being a guest. You're such a really good human, most importantly, but two, you're super knowledgeable clinician who freely shares her opinions and sort of best practices. And I really appreciate that about you. So thank you again for being my guest.